Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. In our hair fall series, we have come to the second part, which is hair fall in men. So, why are we dealing with hair fall in men? Hair fall in men, we are dealing with it because of the prevalency rate. That is 80% globally if we take male persons, that is from the teenage itself, are suffering from hair fall. So we'll dive into the topic to know about what are the causes of it, how can you prevent if you have started a hair fall issue, and what are the hereditary causes, and how can you prevent even if you are having a hereditary cause. So let's dive into the topic to know more. What is hair fall? See, hair fall in medical terms is called as alopecia. It can occur anywhere in the body where it has hair. That is, all over the body we have hair. It can occur anywhere, and that part is called as alopecia. But today we are dealing with alopecia in males, that too especially on the scalp, that is male pattern baldness. So in men, hair loss is often referred to as male pattern baldness. It can be represented by thinning of hair and also hair loss, typically at the temples region. As you can see here, the temple region, these both are called the temple regions, especially near the temple region and the crown part. If there is baldness or if there is prominent hair loss, then that is called as male pattern baldness. What are the signs and symptoms of this hair fall in men? As you can see in the picture, see, there is prominent loss of hair near the temples. What do you mean by temples? This part is called as the temple part, and there is prominent loss of hair in the temple region, and also there is receding of the hairline. What do you mean by receding of the hairline? For example, if you keep your four fingers from the eyebrows to the starting of your hairline, and after quite some time, like for example, if you take 2 years or 3 years and you're keeping your hand here on the forehead from your eyebrows, and you feel that there is a gap occurring after 2 to 3 years or after 2 to 3 months in certain cases, that is called as receding hairline. Where your hairline used to start, it will go back. That is called as receding hairline, which is also a characteristic feature of male pattern baldness. Coming to the other signs and symptoms, if you'll see, as you can see in this picture, what is the prominency of this picture? Anyhow, there is temporal baldness or hair loss. You can see receding hairline. Not only that, you will see there is widening of the scalp. If you take a section and you divide it, this part, which is the visible part of the scalp, the part should be very thin. If it is widened, that means there is prominent hair loss. And also you can see there is hair loss in the vertex part, that is the topmost part of the head, and also there is prominent hair fall all over the scalp. Also you can see that hair has started to recede a lot all over. And if you can see here, in certain section of people, the starting symptom of hair fall in men is hair fall in bunches or prominent hair fall. If you see, females are very particular about their hair fall. They will note each and every strand. But men, they just comb one day, they just don't comb one day. But if you are having a good hair care routine, and if you are counting the strands, and if you are getting more than 100 or 120 strands of hair, that means you are having hair fall. And if it is falling in bunches, that is a very serious issue. Coming to the other signs and symptoms, as you can see in the picture, there is patchy baldness. See, you can see patchy baldness especially when the person is suffering from tinea capitis, that is fungal infection of the scalp, or psoriasis also. Even in psoriasis condition also, you can see that there is patchy baldness of the scalp. And in certain section where there is gene mutation also, you can see there is patchy baldness of the scalp. And next thing is, what is the other thing that is also important in this hair fall symptoms is that slower hair growth. This is very, very, very important. For example, you are going to a salon getting your hair cut, and it usually grows in 3 to 4 months, the usual length that you want it to be. And after some period of time, if you are facing this hair fall issue, the growth rate of the hair also will fall down. That is the major factor you need to know. It is the starting factor of this hair fall problem. Next, coming into the investigations part. What are the investigations you need to do if you are suffering from hair fall? See, primary thing before doing all of these investigations is to do a self-examination. What is self-examination? After oiling your hair, after bathing your hair, and after it has dried properly, after combing your hair every day, make sure that the number of strands of hair that are falling off from your scalp are not more than 100 to 120. That is, the count does not go beyond 120. And if this count is going beyond 120, for more than 15 to 20 days, then it is better you consult a doctor as soon as possible. So after consulting doctor, they will just check the pattern of how there is baldness or how there is hair fall. If it is patchy, or if just there is receding hairline, or if there is only temporal baldness, or if there is only vertex baldness, they will check the pattern. And second, they will be doing some physical examinations. What are the physical examinations? As you can see in the picture, this is called as the pull test. So what is pull test? They will take section of your hair and they will start to pull the hair with certain force, and when 10% of each section of hair comes out, this pull test will be done all over it. They will be covering 50% of the scalp with this pull test. That is, they'll pull here, they'll pull here, they will be simultaneously pulling your hair here and there. And whenever they are pulling your hair, if 10% of each section is coming out, or if wholly 10% of their hair has come out in the pull test, that means you're positive for hair fall. Second test that they're going to do is the tug test. So what is tug test? They will take a section of your hair and they will pull in the middle part, okay, not in the root but near the middle part. So what happens if you're using a lot of bad hair care products or too much of hair care products that are not suiting your scalp and your hair, there will be breakage. And not only that, in the starting starting symptoms of hair fall, there will be thinning of hair, there will be a slower growth rate, and also there will be breaking of hair because of the thinning. In the tug test, if there is more than 10% of hairs are being broken, if they come off like this in the middle part, then that is positive for tug test, which means you're positive for hair fall. And what are the other investigations you need to do if you're suffering from hair fall? These are the physical examinations, hair pull test and the tug test. Second thing, what are the other investigations is that, first investigation is the densitometry, second is the dermatoscopy, third one is the skin biopsy. Let us see what are these tests and how are they performed, or what are the results of it. As you can see here, this is called as densitometry. So here under a microscope, they will view your scalp and also they'll view how far and how thick your hair is, and n number of hairs given in a in a square. They will have a measurement. For example, if you take small section, there is a count that there should be certain n amount of hair follicles in that section. If it is less than that, that means your densitometry will say that you have less number of hair follicles which are active or which are growing. This is densitometry test, where they will be telling you the density of your hair and your hair thickness as well, and the hair placement. The second one, which is called as dermatoscopy. See, in dermatoscopy, they will be able to view the scalp, and also they will be able to view if there is any sort of oily nature on the scalp and the thickness of the hair. Here they are measuring how far is one hair from the another and how dense is the hair, okay. That is n number of hair follicles found in a certain area is densitometry. And here in dermatoscopy of the scalp, they will find what is the thickness of the hair and how is the hair present, what is the arrangement of the hair. And then if they are not able to find any of this, if you are having any other scalp infections like psoriasis or tinea capitis or overall atopic severe form of eczema, then they might do a skin biopsy. What do they do in the skin biopsy? They punch the skin, take a little bit of the skin on the scalp, and they assess it to know more about the disease. After doing all of these, what are the other tests which are very, very important to know about your hair fall? First one is complete blood test. Why do you have to do a complete blood test? If you are having poor quality of blood, that can also lead into hair fall. Especially if you are having any sort of iron deficiency anemia, vitamin B12 or megaloblastic anemia, if you are having ferritin levels low, or if you are having your folic acid low, all of this will have an impact on the hair growth also. Thyroid, if you are suffering from hypo or hyperthyroid, there will be changes in the scalp and also there will be changes in the hair growth pattern also, as hypothyroidism can affect your hair fall or it can cause hair fall in certain section of people. Iron and ferritin levels, as we already discussed. Hormonal test. See, what is the difference between iron and ferritin levels here and in the complete blood test? In complete blood test, you will be knowing if there is any sort of inflammation, where there can be rise in the lymphocytes or rise in the neutrophils if it is an acute infection, or rise in lymphocytes if it is a chronic infection. If you are under infection, there will be inflammation in the body which can lead into hair fall. And then hormonal test. So what you have to do for the hormonal test is thyroid, which we have already discussed, which is the TSH, thyroid stimulating hormone. Other than that is the testosterone level. So why is the testosterone level or the levels of testosterone related to the hair fall, we will be knowing in the bodily changes part. And then also in this hormonal test, along with the hormonal testosterone done, it is better to get HbA1c also done, because if you are having high levels of insulin resistance or cortisol development, cortisol intolerance, that can also lead into obesity, which can cause diabetes mellitus, which can further cause hair fall. And then low levels of vitamin D is also the cause of hair fall. Vitamin B12, as I've already discussed in the complete blood test part, it can result in megaloblastic anemia leading into hair fall. Coming to the structure and function of the hair follicle. Here we will discuss in detail what is the hair follicle made up of and what is its cycle, so that we will know in the bodily changes part where the problem is occurring. As you can see in the picture, this is the hair follicle's root and this is the epidermis layer, this is the dermis layer and this is the hypodermis layer. Okay, in the dermis layer itself, you will be having this blood supply. So, what happens if you are having poor quality of blood, that is low in iron, low in vitamin B12 or low in zinc, selenium, or if there is very low vitamin D levels, vitamin B12 levels, there is poor quality of the blood. As you know, even the hormones are transported throughout the body through blood itself. So any fluctuation in the hormone is reflected in the blood, and any lower amounts of microelements like zinc and selenium and any other compounds, improper nutrition is also reflected in the blood. When there is quality of the blood is only low, then the hair growth will not be proper and there will be thinning of the hair. Second thing, see, remember, after the blood supply, here we have the sebaceous gland. Any hormonal fluctuation will cause the sebaceous gland to become hyperactive, causing a lot of oiliness. And if the oiliness is more, what will happen? There will be fungal infection of the scalp, which can lead into hair fall. The hair growth also follows a cycle. Okay, like our body needs time to reset, it takes a 21-day cycle. In the same manner, hair also has cycles for it. What are the cycles? The first one, it is divided into 3 cycles. Okay, the first one is called as the growth cycle. The second one is the regression cycle or the regression phase. The third one is called as the falling phase. Okay. So what happens in the growth phase? Growth phase is literally 2 to 8 years. That means if one hair is properly fed through the blood, it will grow for 2 to 8 years. And then followed by it, there will be a regression phase where this hair starts to become thin, it starts to have split end, and then it will become weak, and that is called the regression phase, which takes about 2 to 3 weeks. And after that, the hair starts to fall within 2 to 3 months. This is the cycle. And after falling in the same area, there will be another hair growing. We have certain medical terminology for all of these phases and all of this part, but we are not going in depth about the medicinal part. But here we are explaining it to you in a detailed manner, so that everybody will be able to understand. These are the phases of hair cycle. And the thing what people don't recognize is that hair is also made up of protein called as keratin. So it's also important that intake of protein is good. If your intake of protein is really bad, that will also affect your hair thickness or the density of the hair and also density of each follicle of the hair. So this is the structure. What is the function of hair? See, hair is not given for aesthetic purposes. Your hair, especially on the scalp, is given for protection, especially from the sun, so that your scalp does not get heated up more and there is no amount of water that we are losing from the scalp. Okay, to prevent water loss. And second thing, for protection. And the third thing is for thermoregulation. All over the body we have hair. So why is that we have hair all over the body is that it is for thermoregulation, so that when the body is getting heated up more, it cools down through sweat. And also when we are in colder climates, the hypodermis layer, that is a subcutaneous layer, there is fat which will be having a blubbing effect, that is it will protect us so that the heat inside the body, it's trapped inside and it is not going out. So it is especially for thermoregulation. The hair purpose is for thermoregulation. Next, coming into the causes and risk factors. First one is the genetic cause and the risk factor. If your grandfather is suffering from male pattern baldness, you will be getting 20 to 30% increased risk. If your father is suffering from male pattern baldness, the risk will increase to 50 to 60%. But it is not sure that you will also suffer from this. If you are making healthy lifestyle changes, you can be able to resist this, because genes are one thing, and the second thing is the environment and the development of our other bodily changes that we can do while we are still living, so that the next progeny will not suffer from it. Second thing, aging. See, as you start to age, the hair blood supply, quality of blood will decrease, and also the hair will start to fall out, it will become thin, and also thickness will decrease, and also hair regeneration also will decrease. In certain section of people, even if they are not aging well also, the hair is good, it is because of the genes and also because of their lifestyle changes. Next is the hormones. See, regarding this hormones, especially regarding men baldness, especially regarding this testosterone level, we will be discussing in the bodily changes, so that you will know why certain things or doing certain things can raise testosterone, which can raise the risk of hair fall. Next is the nutritional deficiencies. Like we have already discussed, if you have any zinc deficiency, selenium deficiency, protein deficiency, microelement deficiency, if you have deficiency of vitamin D, deficiency of vitamin B1, deficiency of vitamin B6, which is biotin, deficiency of vitamin B12, which is cyanocobalamin, there is every chance you will be suffering from hair fall, even if there is no genetic history. Stress is the main cause, and in the bodily changes I will tell you how stress is related to hormonal imbalance and how hormonal imbalance can cause hair. Medications, certain sort of medications, that is the medications you are taking can also affect the hair cycle. Medications which you are taking for arthritis, that is joint pains, medications you are taking as supplementation, see, increased vitamin A can also cause hair fall, because vitamin A is a fat soluble one and it stays in your body for a longer period of time. If there is hypervitaminosis of vitamin A, that can also cause into hair loss. And also medications you are taking for your hypertension, that is high BP, and medications you are taking for diabetes mellitus, medication you are taking for painkillers, if you are taking any sort of steroids, also if you are taking any sort of antihistamines for a longer period of time, and after an acute illness, if you have taken a lot of antibiotics, that can also cause hair fall. Many people have seen this hair fall issue, especially after a viral infection like after COVID-19, but also after high fevers like dengue or malaria or even typhoid. You will see that there is hair fall 2 months after the infection has started. Then hairstyles and hair products, because of the trending different types of hair videos that we are seeing, many people are trying different hair products not knowing what their scalp is and what their scalp needs and what their hair type is. So if you are using a lot of hair products like dry shampoos, mousses, gels, a lot of blow dry, that can cause thinning and eventually cause baldness if you are not taking proper care of. Next, coming into the bodily changes part, here I will be explaining it to you, the relationship between stress and other things to the hormones, and from the hormones to your hair cycle, and from the hair cycle to the hair fall. Let's go deep into the topic. Let us know in detail about this hair fall. So there is certain thing called as DHT, which is because of the testosterone hormone. Males have testosterone hormone, and if 100%, if you are taking 100 ml of testosterone hormone, out of that 100 ml, 10 ml is converted into this dihydroxytestosterone. Okay, all of this is responsible for maleness, that is all the male gonadal expressions, that being a male, whatever you develop is because of this testosterone and also because of this DHT. What happens when this testosterone increases? Why does this testosterone increase? See, if you are doing a lot of workouts, especially weightlifting, not cardio but weightlifting, a lot of weightlifting, and if you are taking a lot of whey protein, if you are taking protein without any fat content in it, that is no fat added to it, and also if you are doing a lot of steroids, to pump your body, and also if you're an athlete also, in certain section of people, testosterone level will increase. This is all physiological level of testosterone increase. What is the pathological level of testosterone increase? If you are having any sort of adrenal tumors, if you are having any sort of tumors in the body or cancer in the body, if you are having hormonal changes due to stress, stress will cause increased cortisol level and also increased testosterone level, or it can completely decrease the testosterone level. It depends upon the type of stress. So if the stress is there, it will cause the testosterone level to increase. This testosterone level, out of the 100 ml, 10% is converted into DHT, right? If the testosterone level is increasing, so the amount DHT is being produced in the body is also increasing. So DHT has some negative feedback on the hair. So what happens is that after the hair is starting to grow, it will take 2 to 8 years for the hair to grow, right? And then 2 to 3 weeks for the hair to stay as it is, and 2 to 3 months for the hair to fall off. What this DHT does is that this DHT will affect this growth cycle, which is of 2 to 8 years. It will decrease the growing cycle and it will increase the regression and the falling cycle. So the number of hairs falling will increase, the number of hairs growing will decrease, and not only that, the next hair when it should grow na, there will be follicular minimization or miniaturization, wherein the hair is starting to grow. It needs a certain space, right? That space is closed when there is high amount of DHT. So high amount of DHT is either caused because of too much of weight lifting, taking steroids, pumping up your body, or if you're having pathological tumors, and also because of certain medications like steroids, and also BP medications, your diabetes medications will have certain effect on the testosterone level, where it can increase or decrease it. So all of these medications will have bad effects on your hair, and also taking a lot of whey protein also. So here the hair will start to shrink, the hair follicle will shrink, and if you can see here, unhealthy hair will start to be produced, and after the unhealthy hair, no hair will grow. So that is why many people, if they are suffering from male pattern baldness, their hair or their scalp will be very smooth, because there is closure of that hair follicle. So there is no pore itself. Okay, so there will be smooth scalp. So this is how DHT or high testosterone level will affect the hair pattern. Now let's get into the conventional treatment, which is the allopathic form of treatment. If you are suffering from hair fall, regardless of the gender, regardless of why you're suffering, regardless of the cause and the risk factor, everybody might have used minoxidil. As you can see in the picture, it is applied like this. See, minoxidil 2% or 5% is given so that your hair growth or the growth phase of the hair is improved. As soon as you stop this minoxidil, again the hair growth pattern will be disturbed, and also it will start to regress and the hair will start to fall off. Any new hair which has started because of the minoxidil will fall off in people who are suffering from hormonal changes which are not treated. Okay, and only this minoxidil will work in people. It will work on everybody mostly, but if you stop using this minoxidil, the hair will fall off in people who are suffering from hormonal diseases, and people who have just had an acute illness and after that the hair has fallen, or people who have just used a lot of bad products, for them the hair has fallen. It will work on them properly. Even after stopping also, the hair will stay there. Many people will use ketoconazole shampoos also if they are suffering from tinea capitis, that is a fungal infection. Remember that fungal infection is also related to your hormonal imbalance, where it can cause oily skin, leading to a lot of oiliness, leading to yeast, leading to unhealthy habits, and then this fungal growth. Fungal growth, instead of using ketoconazole, which will work on your body, and again you will be developing this tinea, you can use homeopathic medications to give you better relief. Next, coming into the surgical treatment, the other options are, in the surgical part, hair transplant if you have lost whole of your hair, and also follicular unit extraction, where if there is certain bald spot where your hair has been lost, then there will be hair transplant in this certain section. This is complete hair transplant, as you can see. Next, coming into the other treatment options, you can find these treatment options all over India, all over the globe, in every aesthetic clinic, which is low level laser therapy and platelet rich plasma. If you are having any sort of blood related problems or the low quality of blood, even the PRP won't help. But if you are taking proper hormonal balancing homeopathic medication, without side effects, and you're opting for this low level laser therapy, you can get much beneficial effects if you're combining both of them. If you're suffering from hair fall and if you're looking for an answer, does homeopathy treat every case of hair fall? See, if you're genetically having hair fall issues, if your father is having hair fall issues, if you are having unhealthy hair lifestyle, if you are having a lot of stress, if you are eating really bad food, then no matter what sort of treatment you take, allopathic form, Ayurvedic form, homeopathic, Unani, you can go anywhere in the world and you can opt for a treatment, you will not get a result. You should do certain lifestyle changes, and in this genetical history, if you are not doing lifestyle changes, nothing will work. But if you are suffering from hormonal changes, that is high testosterone level because of side effects of certain medications for tinea, or it can be BP, or it can be diabetes, it can be painkillers for your arthritis, or if you're using steroids for any sort of problem, here homeopathy can play a major role. See, there are medications for hypertension, there are medications for diabetes, there are medications for arthritis, there are medications for hormonal imbalance in homeopathy. Without any side effects, we can balance the hormone, thereby treating your hair fall as well. And then here in homeopathy, it is completely safe, so you don't have to worry. Even if you're suffering from fungal infection, you can check our video called as Tinea, where we will be listing out to you clearly how homeopathy is a better option in treating fungal treatments or in having a fungal treatment outcome. Understanding the symptomatology and the type of stress is also very important. See, homeopathic drug varies or remedies vary from one person to other person, even if you are in the same family. If you are suffering from financial stress, then there is different kind of medication and different kind of symptomatology that you will be presenting with. If you are suffering from different sort of stress, maybe your heart is broken, if you're emotionally broken, you have different kind of stress, we have different medicines for that, so that the outcome of each stress has different symptomatology. If we treat the cause of the disease, the symptomatology will automatically subside. And then holistically treating and individually treating is the best part of homeopathy, where no two people are alike. In the same manner, medications for no two people, even if they are suffering from the same symptoms, are alike. So opt for homeopathy if you are suffering from any of this allopathic medicinal side effects, and also if you are suffering from hormonal imbalance. What are the precautions you need to take if you are suffering from hair fall? See, the primary one everybody will tell you is stress maintenance, either through yoga or either through meditation, or if you're not able to manage your stress through either of this, do pranayamam. Even if you're not able to do that also, or if you're not having positive effect on of because of any of this, try to take a counseling session, because one counseling session can improve the perspective of how you're viewing your problem. Okay. And then a healthy diet which includes a lot of fiber, lot of protein, and decreases red meat and phytoestrogens like soya, and decrease your soya products and your red meat products, which is mutton, pork, beef, and lamb. Staying hydrated. What do you mean by staying hydrated? I drink a lot of water. See, drinking a lot of water is different, gulping down it is different, and sipping is different. If you gulp down, that is, if you are drinking this much of water in one gulp at a time, it is of no use. Okay, try sipping water. If you sip water, that will be very beneficial to you. And also, see, there is a thirst center in the body. So if you are really feeling thirsty, your saliva will get dry, your mouth will get dry, and your body will tell you to stay hydrated. You listen to your body. If you are already hydrated, you don't have to overhydrate yourself. You can kill yourself if you are overhydrating. Drinking too much of water can also be very harmful. So listen to your body. Quit smoking and limiting alcohol. This is very, very, very important, because alcohol at least we can excuse to 20 to 30%, but smoking, the nicotine content will decrease the sperm count, it will make your skin dry, it will make your skin dark, and it will make this DHT rise, and also the hair will start to fall off really badly. So stop smoking if you want to, if you have any of these issues. Then treat nutritional deficiencies by taking proper food, And managing medical conditions is also important, and how you manage is also important. If you're taking medicines for your diseases and you're having side effects, there's no point in taking it. So try opting for something which is safe, like homeopathy. And taking good hair care, not using a lot of products, is also very helpful. What happens if you neglect your hair fall? First thing, if your hair fall is because of any medical condition, then that should be treated. Otherwise, the medical condition can have a bad prognosis where we are not able to treat it anymore. And also, the hair will start falling off, receding, becoming thin, and you might go completely bald. So, do not neglect your hair fall, especially because hair fall is related to the internal health, not only internal physical health but also your mental health. Next, coming into the consultation part, if you are someone suffering from hair fall and you would like to get in touch with us, you can contact us either through online consultation, which has two options: audio and video consultation, or if you're staying nearby the nearest branch of Fidicus, you can come and consult us in person. After the doctor consultation is done, if we need, we will ask you for any sort of investigations. If you already have them, you can share it with us. After all this process is done, especially the online consultation, the medicine will be sent directly to you to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days, and across the globe anywhere, it will take 4 to 8 business days. If you would like to get in touch with us, you can call us, WhatsApp us, ping us, or messages on this number which is shown on the screen. If you would like to know more about us, you can check our website www.fidicus.com. If you're someone suffering from hair fall, you are looking for a proper cure, why should you choose Fidicus Homeopathy? See, Fidicus Homeopathy stands for highest chance of health. Here we follow three principles. We are already treating cases who are having hormonal imbalance, having side effects of allopathic medications, and who are having this hair fall issue with high success rate. The transparent treatment, there is no gray area between the patient and the doctor. We will explain everything to you in detail regarding your prognosis. And also the personal care. If you are having any sort of queries or if you are having any sort of doubts, we will clear it to you. The personal care here at Fidicus is top notch. If you are looking for cure, try opting Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.